So thank you everyone for being here for the first webinar in our Reopening Your Business webinar series. So our session today is preparing to reopen your business in Halton, keeping employees and customers safe. So again, I want to welcome you on behalf of Halton, the Halton Small Business Center. I just wanted to just let you know about a few housekeeping items before we begin. Please, you can submit questions under the Q&A box. We will be doing our presentations and then that will open up Q&A afterwards. But if you have any questions that come to mind as we go along, please put them in the Q&A chat box. We will also be using the chat box for information, so look there for links and other information as our speakers go along. So we'll keep the chat box there for links and other information. So please use the Q&A box. We'll try to get to as many questions as we can throughout, but you know, if we can't answer your questions right now, we were absolutely following up with you. So so thank you for that. So good morning, my name is Stephanie Mazzari. I am the manager of the Halton Region Small Business Center. So we're pleased to have you join us on this webinar, which focuses on preparing to reopen your business in Halton and keeping your employees and customers safe. The Halton Small Business Center provides services and support to Halton's business community. In normal times, we're located at the Halton Regional Center at 115 Run Bronte Road in Oakville. But during this pandemic situation, we're providing our services virtually, including one-on-one consultations with our small business consultants. And you can find us online at halton.ca under business or halton.ca/small business. And we're here to help. So we're absolutely available for help during this time virtually. We also have a page regarding COVID-19 resources for businesses. So please visit this page for updates. So we're now a few days into the Ontario government stage 1 reopening of the economy. Businesses across our region are reopening and doing their best to ensure the health and safety of their customers and their staff. Yet questions about reopening effectively and safely still abound, and it's this topic that is the focus of today's webinar and Q&A session. So as I mentioned, this morning's webinar is part of a series on reopening and recovery. Next Monday, June 1st, we have a webinar for restaurants and personal services. The Wednesday, June 3rd webinar focuses on agritourism businesses, and Thursday, June 4th deals with business strategies aimed at business recovery and the new normal posed by COVID-19. All of these webinars will be recorded and posted on halton.ca. And you can register for these upcoming sessions at halton.ca/small business. This morning we'll be hearing from Halton Regional Gary Carr to provide opening remarks. We will also be hearing from Doron Melnick, partner with KPMG Canada, who will help frame where we are in the reopening of the provincial economy, the changes faced by businesses, and he'll walk through an organizational framework for reopening. Doron will be followed by Laurie Shepherd of Workplace Safety and Prevention Services, who will outline how her organization helps keep Ontario workplaces safe for employees and customers by providing education and practical guidance. Following Laurie's remarks, we will jump into our Q&A. We've received some questions already, but again, if you have a question, please use our Q&A button at the bottom of your Zoom screen, and we will do our best to answer them. So now it is my pleasure to call on Halton Regional Chair Gary Carr to provide opening remarks and welcome you to this webinar. Chair Carr, over to you.
Thank you very much, Stephanie. I really appreciate the great work that you're doing. And I also want to thank John Davidson and everybody involved and our Commissioner, Bob Gray. As many of you will know, we've been working hard through all of this in a number of areas, but our business development has continued to go on and we will continue to do that. So thank you. It's needless to say some different times, but we will be operating and trying to continue to help the businesses in Halton region. I want to thank our speakers, to Doron and Laurie. We've got great speakers here this morning, and we really appreciate you taking the time to come out and bring your expertise. I want to read a quote from you. Many of you will know Peter Drucker, who of course was the famous management consultant. He said, The greatest danger in times of turbulence is not the turbulence, it is the act of yesterday's logic. Now, I don't think Peter Drucker knew we were going to be in the middle of a pandemic when he said those words, but needless to say, we're going to be doing things a lot differently over the next little while, regardless of what your business is. One of the things we prided ourselves on in Halton region is doing things differently, and we're going to certainly have to do that going forward. You also should watch for the ongoing future webinars. We will be having some of them, like Stephanie announced there. And this one today is probably the one that kicks off extremely importantly, because regardless what we do, regardless of what industry you're in, you're going to need to keep your staff and your customers safe. So hopefully you will learn a great deal from here today, and then going forward, you can also stay tuned for some of the other things we're doing. So to each and every one of you, thank you for all that you're doing. It is our intent and our hope going forward that we will be continued to be the leaders in creating jobs in this province. The final thing I will say, I'll be leaving a little bit this meeting. We are getting together with the mayors and chairs from the GTA. And one of the things that I think we realize very clearly is that Halton region being part of the GTA and including also Hamilton, the country and this province needs us to come back strong. And we intend on doing that and doing our part in Halton region. So back over to you, Stephanie, and thanks again to the speakers, to everyone participating. And I know it's going to be a great session. Thanks, Stephanie.
Thank you very much, Chair Carr. That's great. Yeah, we're really excited to be presenting this webinar series for you. And again, we're at the region, we're trying to help on so many levels, and this is just one opportunity for us to work with our local business community. So thank you, Chair, again, for your words and leadership and that of Regional Council in helping to fight the COVID-19 pandemic here in Halton. So now I'd like to turn it over to Doron Melnick, Partner and Acting National Leader, People and Change Services at KPMG Canada. Doron's practice area is in operational change across multiple industry sectors. He works with clients to establish and govern projects to implement changes in process, technology, and organizational structure. Doron, thank you for joining us today. Over to you from your home office.
Thank you, Stephanie. So thank you everyone for having me today. My background is not accounting, as the KPMG name may have you believe. I'm actually an engineer, studied in Waterloo, and I worked in IT before I got into consulting. And so nowadays, really for the last 15 years, I've been working with organizations around dealing with change. And that includes all those things that Stephanie mentioned, including operations, processes, technology, and people. Now, most of my clients happen to be large organizations, but I also come from a proud heritage of small business. My father runs an auto parts and servicing shop. My aunt and uncle are in jewelry, and I worked in retail. I drove deliveries. So I've got a bit of background in small business, and I understand the unique challenges of that environment. What I wanted to do today was talk to you a little bit about the general planning that's involved in bringing people back to the workplace. So we do know that essential businesses have remained open through this whole time. But for anyone who is a non-essential business, it's really only in the last 1 or 2 weeks that the provinces have started to issue plans around reopening. And in Ontario especially, that really happened last week. And so guidance has been provided by the provincial government. And now many organizations, businesses, and not-for-profits are working through the details of that. It was very easy to send people home, a bit more challenging to bring them back. So what I'm going to do today is talk about that. And we ourselves at KPMG are going through this process. We have about 7,000 employees, but in a way it's a collection of small businesses because we have many offices in towns all over the country that are just from a few hundred square feet up to a few thousand square feet of mostly office space. But we are accustomed to seeing our clients physically in our offices, and that has needed to change, and we've really moved to a more online approach. So we're in the midst of that, and I can talk a little bit about that if folks are interested. What I'll do now is I'll just share my screen. and provide sort of a broad overview of how we're thinking about the return to work. Okay, Stephanie, can you just confirm you can see my screen? You can see it, great.
Yep.
Okay. So our goal here is to provide a broad overview of the things that you would need to think about in bringing the workforce back to the workplace. I won't go into a lot of detail on health and safety because our colleagues Lori and Stella will be presenting on that topic after I finish my part. So when KPMG discusses the COVID-19, the pandemic and its effect on organizations, we talk about it being a journey, and it's a journey of 4 steps. It started with reaction. You know, like many of you, back in March, we shut down our offices and sent everybody home, and we've been working remotely since. And then we entered a resilience phase, which was really about figuring out how to work in a remote way. Or providing services to customers in new ways. This was interesting what we saw in the retail space, companies adopting curbside pickup and online delivery to a larger degree. And for any kinds of companies that had paper processes that needed signatures, figuring out ways to get those online and digitized. And certainly for people working remotely, making sure that they could actually connect and do their work. And many organizations are now entering the recovery phase, which is thinking about bringing people back into the physical workspace and expanding the services to customers. And that period that we're in, that gold period here, this recovery phase, that's going to take, as we don't actually know, this could be months, possibly 18, 24 months. But what many organizations are also thinking about whether any of these changes will be permanent, and whether their business will need to operate differently as a matter of course. And that's that last phase of new reality. Now, in terms of that journey, where are we now? So this slide has an illustration of a couple of curves. Sorry, I'll just hide the chat window so you can see this. So we are basically at we were at the trough at the bottom of the curve, which was essentially confidence level 1, staying at home, and we're starting to enter confidence level 2, where provinces and health authorities have issued health and safety guidelines. We're starting to see a return to the workplace, and we're starting to see more stringent health and safety controls. And so that's what the purpose of today's discussion is. The next level up will be making sure that PPE is more readily accessible to everyone who needs it, and then getting into things like comprehensive testing and contact tracing. And we know that in Ontario, we have various challenges associated with that. And then eventually, when we get up to level 6, where there's a vaccine, we hope that we will be restored more or less to normal. But until that happens, it's really about restoring public confidence through controls and protection for health and safety. If we can get the public to be more confident, then we will see the economic recovery. And so that's the imperative for all organizations. Let's create that confidence by communicating with our customers, communicating with our employees, and showing them what we are doing to keep them safe. Okay, I'll go to the next slide. So as far as returning to the workplace, what's involved? You can think about this in terms of 3 groups that need information and guidance. The first group is the blue group here on the right. The blue group represents the ownership of your business. If you have a board of directors, then that would be the board. And it could potentially be your legal counsel, your accountant, people who are responsible to help you run the business and protect the business overall. Then you have the group at the bottom here, which is the gold. These are your employees and people who are going to come visit you at your workplace. That could include customers, suppliers, and vendors, and other folks. And they're going to need information, they're going to need education, they might need equipment. And then finally here in the green on the left, these are the people who are running your operations day to day, your operations managers, facilities managers. If you have an IT technician or an IT team or an HR specialist, These people will need information and guidance around what they need to do to keep the workplace safe and to provide employees and visitors with the information that they might need. So the next slide elaborates on that a bit and provides a list. It's a to-do. You can think of it as a to-do list. Depending on the size of your organization, it might be one person that has to do all of these things. And it could be in a larger organization, it could be a small team of 3, 4, maybe 5 people. And you would start by establishing that team, that task force, and then working your way around the circle to think about all the aspects. We will make this presentation available so you can review the list at your convenience. I'm not going to go through it in detail right now, but you can see from scanning the slide that it is fairly comprehensive and covers the aspects of the return that you would need to think about and plan for. I'll just pick a few at random. So returning to the workplace approach, this is figuring out which sites to open first and which to open next, and figuring out who should come back and when. I'll talk about that a little bit later in my presentation. Another aspect could be health and government guidelines. So that's about staying up to date with the guidance that's coming out of the public health authorities and the workplace safety agencies. Another one could be commuting and travel guidelines here. So this is about providing information to the employees that are coming to your site, especially those that are going to be taking public transit. And then another one could be workplace redesign and improvement over on the left, number 17, to determine how you might space people out in your workplace, if that is possible. If it's not possible to have people sitting further apart, then maybe consider having your teams come in on a rotating basis. So half your team comes in one day, and then the other half comes in the next day. So those are examples of things to think about in your return to work plan. A way to think about stepping through this is to move around the circle multiple times. So in the first place, you might work your way through those 23 items to understand what is your current state, what is your current thinking, and what are your current plans. And as you do that, you might notice that you've got a few spaces, a few areas that you haven't thought about yet. So you would want to figure out those. Then the second time around the circle, you would build the plan for each area. And then you would execute it and make things happen. And in the third time around the circle, you would make sure everything is ready to go and you could start to bring people back. And then in the fourth and subsequent waves, you're going to be monitoring and checking that everything is working as you expected. You might make adjustments. In the event that there's further outbreaks, you may actually need to move backwards and scale back some of the return to work. The whole idea here is to phase it, is to do it carefully so you don't bring everybody back at once, but have a gradual return. And at all stages, making sure that you're protecting the health and safety. So just a bit of thought on which sites, who, and when. There are a few considerations. On the far left, figuring out where you should reopen and when to reopen, you would look at things like the community risk level. So the region of Halton actually has a great website with lots of information, and I encourage you to visit it. It does have information on case counts and trends, and so that can give you a sense on whether the curve is flattening. And we do see that it has been fairly flat and stable for the last few weeks. You could also look at facility risk level. So look at your physical space. And you could look at factors like air quality. Do you have good ventilation and good airflow in your space? How large are your common areas? Can you space people out? Or are there narrow hallways where you need to be careful around how many people are in there at once? If you have elevators, if you rely on elevators to bring people up to your office or your work site, then you may need to establish a slow return to work or careful scheduling so that you don't have overcrowding of elevators. And you might want to consider making your doorways touchless to have motion sensors and opening automatically. And in the bathrooms, having touchless fixtures. And also ease of cleaning. Is your workspace easy or difficult to clean? So basically, if your workplace is relatively straightforward and easy for physical distancing and touchless interactions, then you can think about opening up earlier. But if you do see challenges there, give yourself more time to plan. And then in prioritizing who should come on site, you can continue to look at whether people physically need to be there or not. If they don't need to be there, it may not be as much of a rush to bring them back. You can have them working remotely for a longer time period. You can also look at their need for in-person interaction. So if there is a need to interact so that people can collaborate and generate new ideas and solve tough problems, sure, bring them in a way that they can be physically distant. But if they don't need that interaction, then postpone them in coming back. Also look at the employees. If your employee group is older, more vulnerable due to underlying conditions, then figure out a way to postpone them coming back. If they're less at risk, then they can come sooner. And then finally, employee sentiment. So employees may not be ready to come back. So if there's a way for you to reach out and find out how they're feeling, absolutely do that. And so when we do talk to clients, the things that are top of mind for them are really access controls in terms of keeping tabs on who's in the office and keeping tabs on when they're in the office, maybe looking at scheduling, looking at screening questions at the door. Our client organizations are looking for advice on that. Physical distancing is important, and we recommend that you work with your facility manager or your landlord to figure out solutions for that. Personal protective equipment is also very much on people's minds. And so that's a high priority to see if you can get a supply of masks and or gloves. And for some employees with close interaction with others, maybe even coveralls and more industrial strength breathing protection. Finally, workplace cleaning and hygiene. It's important to establish daily or even more frequent cleaning. And so our document does have some recommendations, but I don't want to steal the thunder of your workplace safety organizations in Halton. Laura and Stella will cover that in more detail. They have many, many great recommendations and great documentation for you to look at. I just wanted to reference quickly, we do have, this is something that KPMG did not do, but we noticed that it's out there and it's a great resource. I recommend that you look it up. It's the Retail Council of Canada. They've issued a playbook for retail companies. And so if you do operate a retail space, or even if you don't, if you have customers visiting in your office, I recommend you have a look at this document. It is full of very good examples of things that companies are doing. So it gives you examples of signage. It gives examples of ways to keep customers safe, including hand sanitizer, masks, sometimes for purchase, various means of social distancing in places like restaurants, things like click and collect, setting up outdoor counters, especially now that the weather is better, and signage. So I do recommend that you have a look at this document. It's full of really, really fantastic research and great examples that you might be able to implement in your own organization. So that's my presentation for today. Again, just to recap, we will make my presentation available so you can review that list of to-dos. I recommend you look for this Retail Council of Canada document. You can download it from their website, and also browse to the region of Halton. A lot of great information there with COVID resources. So that's it. I'm going to stop sharing my screen and I'll hand it back to, I guess, Stephanie, will you hand it over to Lori or Stella?
Yep, thank you. Thank you so much, Doron. I really appreciate that. That was fantastic. Yes, so now I wanted to introduce Lori Shepard, who's a Regional Community Coordinator with Workplace Safety and Prevention Services. With more than 25 years in the field of occupational health and safety, Lori connects with small businesses and communities in Southwestern Ontario, to share information with their clients. So I wanted to pass this over to Lori now. We've got your presentation up on there. Great. Thanks so much. Over to you. Thanks.
Great. Thank you, Stephanie. And thank you for having us here today. So I just want to see if I can move my slides forward. There we go. Okay, just to remind you that this presentation is for informational purposes only. It's not intended to provide advice. This information is current as the information that we know as of today. We know that things are changing very quickly. So if you have any specific questions related to COVID-19, we do have a duty consultant, and we'll make sure that we provide this information to you in our slides as well. WSPS.ca will continue to update our COVID-19 pages with current resources on a regular basis. So basically, just a little bit about who we are. So in case you haven't heard about us before, Workplace Safety and Prevention Services, or WSPS, we are a not-for-profit organization, and we're committed to protecting Ontario's workers and businesses. We are a proud partner of Ontario's occupational health and safety system. You may have heard us mentioned recently, along with the other health and safety associations, by the minister regarding certain safety guidance documents for helping businesses with their reopening. We offer health and safety expertise, consulting, training, resources, and today we're going to highlight some of those resources for you. Our mandate is all about helping businesses understand their risks and their legal responsibilities to stay in compliance with the laws and to build safer workplaces and safer communities. Our vision is every worker healthy and safe every day. So COVID-19 has created some unique challenges for all industries and all businesses. The public health and safety resulting from dealing with the general public during the pandemic has changed the way that businesses must operate and the way that business must be done, while highlighting new challenges to protect the health and safety of the workers and the customers. So when we look at any workplace hazard, WSPS recommends that we follow the RACE model. So this is about recognizing, assessing, controlling, and evaluating each hazard. So we're going to go through this model with regards to COVID-19. So we're going to specifically focus on this. So just a little bit about the recognition. So we all know that COVID-19 is a disease that's caused by a virus, and this causes an outbreak of a respiratory disease, and it ranges in severity. The transmission is through droplets, through close, unprotected contact with an infected person, and it also can spread through us touching surfaces, hard surfaces, and then touching our noses, our eyes, or our mouth. So what we need to do is to actively manage our hazards, we need to recognize how our people can come into contact with the virus and how do we minimize this contact. So when we talk about assessment, we're looking at probability and severity. So what's the chances of us being infected, and then how bad can it be? So we also are looking at the risk to our credibility and our financial viability. So we know with COVID-19, the probability of us being affected can, as mentioned previously, it can depend on a lot of pre-existing conditions. Each person's immune system is different, but we also know the consequences can be devastating. We're looking at the severity could be fatalities. So we need to look at all of these when we're doing our risk assessment. When it comes to controls, we need to look at our hierarchy of controls. So ideally, we want to be able to eliminate the need for people to interact with other people, like what we're doing today by having a virtual meeting. If we can continue to have virtual meetings, if we can allow our workers to work from home, those kinds of things. If we can't, we can look at things like engineering controls. So we've all been in our local grocery stores lately, and we've seen the plexiglass barriers. So can we do that? Can we have physical barriers when the face-to-face contact can't be avoided? Can we redesign our workspaces to allow appropriate distancing? And again, we've all been out and about, and we've seen the arrows, we've seen the the control measures in place to make sure that we're keeping, again, 2 meters apart from other people. We've seen arrows to encourage people to go in one direction. So we're seeing that a lot in our community. So this is where the engineering controls can really help to isolate the people from the hazard, because we can't totally eliminate it at this point. So what can we do? When we get into administrative controls, this is where we're talking about hygiene. So we've heard lots on the news about making sure that we're washing our hands. So in our workplace, do we have enough soap? Do we have paper towels? Do we have tissues and hand sanitizers? Do we have the waste bins? Do we have our portable disinfectant stations, especially in the high traffic or heavy populated work areas? Do we have signage to encourage people to continue to make sure that physical distancing is something that we're all practicing? Do we have health screening in place? Do we have people making sure that we're assessing ourselves? So we do have some screening documents, some self-screening documents on our website as well. Do we have people at our doors to make sure that people aren't coming into our workplaces who may be exhibiting signs of COVID-19? Do we have things in place to make sure that we're decontaminating our surfaces? Do we have enough stock of our decontamination supplies? And again, do we have training in place? Because we've got a lot of change going on. So are we making sure that people are aware of the changes to our workplace protocol? Last but not least, personal protective equipment, or PPE. So for any worker who is assigned to use PPE, we have to make sure that people are trained, that we have the adequate training on the selection, safe use, proper donning and doffing, making sure that we have proper cleaning and disposal procedures in place. We have to understand the limitations of the PPE as well. We need to be following the manufacturer guidelines as far as if we are storing our personal protective equipment, if there's any that it's reusable, do we have proper places to store them? We also need to make sure that our PPE does not interfere with controls that are already in place. And we need to consider the quantity of our PPE, that it's available. Think about our gloves, our masks, our face shields. And again, do we have proper disposal bags for all of this? And this will be available. We do have, again, a COVID-19 page on WSPS.ca, and we do have a post-pandemic playbook that outlines all of this in a lot more detail. So these are the things we need to consider. With all controls, we have to remember that it's really important that you continue to follow the laws and directives provided by the provincial government and the federal agencies. All measures taken to prevent the spread of COVID-19 should be done in compliance with the Occupational Health and Safety Act, the emergency orders made under the Emergency Management and Civil Protection Act, as well as the public health directives and guidance issued by the Ontario's Chief Medical Officer of Health and the Ministry of Health. So this is changing on a regular basis, so we need to stay current. The final step of the RACE model is to evaluate the effectiveness of our controls and to make adjustments where necessary. So we need to look at are things working? Are things getting better? Or are people understanding how to follow the controls? And we certainly don't want to make anything worse. We don't want controls to be cumbersome, and we certainly don't want to make things worse. So we need to understand that the information is changing daily, and new directives might require you to change some of your controls to better protect your workers and your customers. Okay, I mentioned our post-pandemic business playbook. So this is an interactive document with links to all kinds of resources. And this playbook lays out processes to raise awareness and talks about different protocols for your workplace. So this is a how-to guide for getting Ontarians back to work safely. So you can click on our link and use this document to help you. We do have a number of return to business checklists, and these are just some examples of the checklists that we have. They include the pandemic checklist for businesses that are operating through the pandemic. We have a checklist for businesses returning after a shutdown of operations, and we have a checklist for businesses returning to the workplace after working remotely. So there are a number of these that you can download and use. We have some guidelines and job aids, and these were developed in partnership with the Ministry of Labor, Training and Skills Development, along with the other health and safety associations. So we have developed some technical sector-specific guidelines that are guidance documents that can assist the employers as they prepare to reopen their businesses. These documents outline safety measures that should be followed so that everybody can be kept safe. The Small Business Center, WSPS Small Business Center, has a lot of other information as well. So these are the landing pages that you will see when you visit WSPS.ca. So you'll see that we have 3 different roadmaps. So 1 to 5 employees, 6 to 19, and 20 to 49. So click on that to get checklists and all kinds of information to help you, again, to protect your workers. And this includes your duties and responsibilities, posting requirements, training and orientation information, as well as return to work information. So all kinds of information is outlined in our Small Business Center. We also have a small business advisory service. So for companies with 20 or under employees, you will have access to, basically it's like having a coach. So if you are interested in having somebody help you to navigate through our small business resources, somebody who can be an advisor to give you advice and assistance and help you with our handbook and different practical tools, we have that available for you. So you can just reach out to us and we'll make sure that we provide somebody to help navigate the system. As I mentioned too, we do have a duty consultant who is available from 7 a.m. to 7 p.m. every day. Just call our toll-free number or you can send us an email. And basically, if you have any specific questions from your workplace, you can reach out to us and we will do our best to answer these questions for you. And that's basically it. So thank you.
Great. Thanks so much. Thanks so much, Lori. That was fantastic. Lots of information to take in, and we have some questions that hopefully we can pose to our panelists today. If you can answer them, that's fantastic. If you want to be on video, that's great. If not, that's fine too. I'm just going to go through. We did receive some beforehand, so during the registration time. So I'm going to just ask a few questions and you can kind of decide who can take them on. So we've got one with regards to retailers. So can retailers screen customers at the door for entry? So if, for example, with temperature testing, do we know if that is something that you're aware of? Maybe perhaps Lori, that's a question for your team.
There has been a lot of screening going on, but what I've mostly witnessed is just having somebody visually doing a screening, and I've experienced that myself. So you get in the line and somebody's at the door and they're monitoring. Also, it helps to monitor the physical distancing as well, but they would see if somebody's exhibiting signs or symptoms. So I have seen that. And I have heard of some companies actually using other mechanisms too, like temperature as well, you know, remotely. But most of it that I have been aware of is just people doing a visual. So if somebody's coughing and sneezing, they can be asked not to enter the workplace.
Okay, great, thank you. Also another kind of retail focused question. Is there a health and safety risk presented by the handling of cash, money, or credit cards? And is that something that is that retailers should be aware of? And is there solutions around that?
A lot of this too, again, what I've seen in practice is a lot of retail establishments are using the tap feature. So as far as we know that the virus can live on hard surfaces, as far as how long it can live on money, that is an unknown at this time, but a lot of places you're doing a tap. I have been in workplaces too where they sterilize the machine in between, if it's one of the ones where you have to touch, that they are cleaning it, wiping it down, and that they have hand sanitizer at the cash station. So I've seen that as well. There has been no directive for workplaces to stop taking money. So in that case, if they're still continuing to take money, I've seen the cashiers, again, they have a hand sanitizer right there where they are, the protocol would be cleaning their hands after dealing with any transaction in that way.
Okay, great, thank you. Another question that was submitted to us during registration, should businesses be following the lead of Longo's grocery stores and require customers to wear face masks in their stores? Does this give a business a competitive edge in providing a safe shopping experience? So we have seen, yeah, they're one example there would do require face covering. Otherwise I think, it's been up to the consumer or customer to do that if they so choose.
Yes, and that can be a delicate situation. There was an article that was just posted by the ministry talking about there are some people who may not be able to wear a mask for certain reasons. So again, that is up to the company whether they want to enforce it. I know with the situation in Guelph, I believe that somebody has started a petition, but as far as it being a competitive advantage, I don't really know at this point. So I see a lot of companies where they have it as a best practice that they're encouraging. When I'm out and about, I see the majority of the people are now wearing masks because my mask protects you, your mask protects me, right? So we're all aware of that. Whether a company chooses to make it mandatory or not, that is just their decision that they would have to consult with their own legal counsel to see. So it'll be interesting to see how that pans out. But there are some people who can't wear masks for, again, medical purposes, those kinds of things, right?
Yeah. Okay, thank you. We have a few live questions that have come in, so I'll start with the first one. A lot of employers will question the need to come in. Would you recommend a criteria that employers can use to decide between what are imperative works that need to be done in the space versus done at home? Perhaps, Doron, this is a question for you in terms of the framework. Do you suggest that employers decide, I guess, what can be done, what needs to be done in the office and what can be done at home as part of that criteria?
Yeah, absolutely. I mean, you can boil it down to two criteria. The first one is how much do you need to interact with customers and team members in person? Like if you're doing a physical activity and you need to interact with them, then that would mean that they probably should be coming back. But another dimension is, can you make that interaction digital? Because if you can make it, online, you can make it remote, then the person doesn't necessarily need to be there. That actually creates four categories of people. There are the ones that need to interact closely. They need to interact frequently with others, and it has to be in person. So you think about, let's say, construction site workers would be in that category. So like, there's no way they're working from home. So if you're doing renovations, for sure they're going to be in the workplace. Another example might be in a clothing store. You run a retail environment where customers want to come in and try on the clothes. Your sales staff need to be there for that. And so you need to look for other ways to keep them safe. But then you have people who might be, not necessarily like, yes, they need to interact with others. So I'll pick an example of, say, like a marketing team, or let's say a sales team that needs to meet every once in a while to interact, to talk about, how are they going to increase sales, and they need to talk through some complex issues, pricing, promotions, or you need to work through a restocking situation, it's like a supply chain situation. So what you might do is have them work from home most of the time, but then come in for specific meetings or specific interactions. And then when they are there physically, just make sure they're physically distanced. So they're sitting 2 meters apart. You can often get a lot more done when you're there in person, working through it together as a team, and you can go up to a whiteboard and, draw things, or, make gestures with your hands so people understand what you're talking about. Just that emotional and nonverbal connection can be really important. So that's what we're suggesting is look for ways to bring people in safely when they do need to interact every once in a while.
Great. And what
Yeah.
you mentioned kind of developing that framework and working through those numbers. So is this something that you would suggest businesses do at the upfront, is kind of determine who needs to be in the office or who doesn't, and then what are those activities, or what tools do we need to then to use, to then make that a reality in terms of, being physically in or working from home?
Yeah, that's right. That's right. It comes back to the hierarchy of controls that Lori showed. It was like that upside down pyramid, where the easiest and cheapest thing to do, eliminate the threat. Don't have people come in, keep them at home. But if they do need to come in, then there's, the physical distancing and controlling the access, all the way down until eventually you reach the PPE if they absolutely have to be close together. So that's, the idea is to just work through those and put in as many protections as you can.
Great. So we've got another question that I might be able to answer, but maybe Lori, if you have some additional information. So there's a question: will the webinar include the government guidelines and examples that workplaces, specifically small retail spaces, need to follow to ensure staff and customers are safe? So I know we didn't go over, specifically the province of Ontario's guidelines. They did put out a series of guidelines, quite a large document prior to phase 1 reopening. I can absolutely share that as part of our follow-up with everyone on this webinar. So I can include a link to the government's framework and also the list of guidelines. And it really goes, I think, into detail on lots of different industries and how to keep those businesses safe. But Laura, do you have anything more to add on kind of the retail spaces and government guidelines?
I would say downloading a copy of our playbook, our post-pandemic playbook, would be a real good tool, a good resource, and looking at, again, some of our guidance documents as well, because we developed them and created them in consultation with the Ministry of Labor, Training, Skills and Development, as well as the other health and safety associations. So the guidelines, the job aids, and all of those resources, the preparedness checklists. So just visit our WSPS.ca website. There's lots of great information that can really help them. And again, if they have any specific questions or challenges, then reach out and talk to our duty consultant, where they can talk to them one-on-one, send us an email, and then we can help them with the specifics.
Okay, great, thank you. So there's another question here that's come in about UV lamps. Is there any information about maybe businesses as a recommendation, or businesses that you're seeing installing UV lamps for, I guess, for disinfectant or for safety? Maybe Lori, is this something that...
There's a lot of information out there. I think right now the research is still ongoing as far as depending on what they're trying to disinfect. So again, it's just best to check the Ministry of Labor guidelines. Right now, most of the guidelines are talking about using an alcohol-based decontaminants that have 60% alcohol, but there has been a lot of research as far as the UV, but that's where they would need to get more information and just consult with the experts, and even get some legal advice on whether they should be using that to decontaminate their services, because there's so much new information coming out daily. And if they're ever not 100% sure, again, you can always reach out to the ministry about that, the Ministry of Labor, Training, Skills and Development.
Okay, thank you. We have another question similar to that question. Do staff need to wear gloves?
Well, when you're doing your risk assessment, you'll have to determine whether the gloves are absolutely necessary. So there is a PPE document on the ontario.ca/PPE, because it all depends on the situation. Sometimes gloves can give us a false sense of security. Sometimes we're not able to wash our hands properly then when we have the gloves on, or we start touching our face because so gloves can be a problem. They can also get caught. So they could get caught in equipment. So you'll have to look at each workplace and do an assessment to see if they're absolutely necessary, because you don't want to create a hazard that's going to be worse. And also anytime there's all different kinds of gloves. So are we using the right kinds of gloves? Then we're getting into the fit of the glove. Also the supplies, because right now demand is so high. So again, there's pros and cons. And then have we trained people how to take them off properly? Do we have proper disposal in place? So gloves aren't always an easy solution. It depends on, again, each individual circumstance. So that's where you would have to assess the need, whether you need to have the gloves or not.
Great, thank you. And again, I think, those provincial guidelines, which we'll be sending out to everyone following this webinar, will provide some guidance, specific guidance to different industries. So there is quite a bit of information that the province has released to help you walk you through it. But Lori, as you mentioned before, your duty officer is available to answer questions. So questions can be presented that way as well. So we have another question here. If a business cannot afford to purchase the necessary equipment required to reopen, what can the business do in terms of health and safety and still open and avoid getting fined? Are there any specific measures you know of? So Laura, I don't know if that is one you could answer, or.
Yeah, in a situation like that, the individual workplace would be responsible for obtaining their own professional legal advice in something like this, because depending on the circumstances. So if they're in a situation where they can't afford to operate under these challenging and difficult times, that's where they would have to again seek their own counsel, because this could be based on, again, their risk assessment. If they've deemed that they need barriers or they need PPE, they don't want to take any unnecessary risks, either putting their workers or their customers at risk. So this is a very delicate situation where, yeah, they would have to, again, seek legal counsel, do their risk assessment. So that's really important. So we've identified what the risk is. You've assessed it. How bad can it be? We know that without proper controls in place, people can die. And then once we determine what our controls are, if we're not in a financial position where we can afford to put those controls in place, that's where they would have to, again, seek legal advice. I can't really give somebody advice whether they should open or not open, but it would seem to, again, be in their best interest legally if they at least determine what their risk level is, do their risk assessment, determine what controls are needed, and then if they can't afford those controls, I don't know exactly what's in place to be able to help a business, if there's any programs out there to be able to help them. So they would have to dive a little bit deeper into this and get some legal advice specific to their unique situation.
Great. Thank you. So it looks like we're getting close to noon. So I just have one more question that was submitted to us that I'll pose. So it's kind of a two-parter, but quickly, I think. What can I do as a business owner if one of my employees invokes their right to refuse unsafe work? And what are the obligations of my employees? I don't know if Lori, if that's something you can speak to, and Doron,
Yes,
if there's
exactly.
anything that we could think about in terms of framework for something like
Yes.
that.
So basically, one of our rights as workers in the province of Ontario is we have the right to refuse unsafe work if we feel that our health and safety is at risk or that of our co-workers. So yes, workers can refuse, and they would have to be an investigation. So depending on the size of the workplace, the health and safety representative for those workplaces that have under 20 workers, or the worker representative from the Joint Health and Safety Committee. If they're not able to resolve the work refusal, again, depending on what the situation is, if they can resolve it collaboratively with the supervisor, the worker, and the health and safety representative, then great, right? But if they're not able to resolve it, they would need to call in a representative from the Ontario Ministry of Labour, Training, Skills and Development to come in and determine whether this worker is at risk. So they may have to again bring in the ministry to determine whether. But yes, we still have the right to refuse, and that's if we perceive. So it has to do with our perception. If we perceive that our health and safety is in danger, then yes, we still have the right to refuse unsafe work. But there is a process. And it involves, again, communicating with our supervisors, and again, getting the worker health and safety rep involved in this process.
Great, thank you. Great, well, I see we're very close to noon. Just wanted to, as we wrap up, again, I wanted to thank everyone who's on our webinar today. I want to thank Lori and Doron for their presentations. Again, this information will be provided to everyone as a follow-up email. So we'll include all of the links. If you've been looking at the chat box, WSPS have included all of the information in terms of the links to some of those key contacts and to some of their resources online. So I would encourage you to take a look at that. But again, some of those links will be provided to you. We'll also include those links to the Ontario government's guidelines. So it's quite an extensive packet of information, but really breaks down some of those best practices and requirements that businesses will have to implement going forward as part of the different phases of reopening. So that information will be provided to you. Of course, along with our contact information at the Halton Small Business Center. So I would encourage all of those small businesses who have joined us today on our webinar, connect with the Small Business Center. So we are working with clients looking for information about business relief programs, navigating, applications for some of those programs. So we're there to walk you through it. We're also working with businesses who are really adapting to the COVID-19 situation, pivoting, and also similar to Doron's presentation, starting to put together a framework for reopening for themselves, for their staff, and for their customers, which is really important. So I would encourage everyone to contact us at the Small Business Center for questions and information. So that's halton.ca/smallbusiness or smallbusiness@halton.ca. So again, I would like to thank everyone for joining us today, our speakers, to our chair, Gary Carr, and everyone that has joined us for this one and our upcoming webinars that will happen over the next week or so. So obviously these are exceptionally challenging times for our local businesses, but we appreciate you taking the time to be with us today. And that concludes our webinar. Thank you again for joining us, and we hope to see you on our next session. Thank you all.